The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with my co-host, Otto Lowe's. Otto, you know, I always try and come up with something new to say about you, but longtime volunteer, supporter, friend, the best co-host around, I must say.
The only one here.
Well, you're still my favorite. This morning, we are joined by Dawn Hagen, who is a social worker, which we love here, right, Otto? We love our social workers.
My granddaughter's a social worker who went to Adelphi.
There you go.
Good girl.
Yeah.
Who is a program director of Willing Hearts, Helpful Hands over at Parker Jewish Institute for Healthcare and Rehabilitation. So thank you for joining us. But we also have another guest with her. We have Jeannie Doherty, who is the VP for Community Partnerships over at Parker. So thank you both for joining us. Doing research for the show, there is so much that Parker has to offer. And I could speak from Project Independence world that you guys have been a great partner and such a resource for all of our social workers and nurses. So thank you both.
Thank you. It's great to be here. Thank you.
So let's start from the basics. Give us a little bit about what is Parker, you know, like some history.
Right. Well, so Parker actually started as a homeless shelter up in Harlem, and it kind of just grew into becoming a very healthcare organization, which is now Parker Jewish Institute for Healthcare and Rehabilitation. We're a 527-bed skilled nursing facility. We provide an array of services, not only short-term, long-term services for individuals who are chronically and medically frail, but we also offer a variety of community health programs, such as, you know, we'll go into more detail about those as we continue the conversation. But for all intents and purposes, Parker is a long-term healthcare facility, and again, 527 beds. We house over 1,000 employees who come in to provide care to the individual residents. We're located in on the border of Queens and Nassau County, in New Hyde Park. So actually, we laugh because the nursing home itself is in Queens County, and the parking lot is in Nassau.
Yeah. That's how a lot of things are, and you know, over here.
You dice it up like that, right? But yeah, so Parker's been, you know, we've grown over the years into becoming a very competitive organization and, you know, healthcare provider. We, you know, really focus on the, you know, geriatric division of, you know, care. You know, we provide Alzheimer's and dementia care. We provide, you know, short-term and long-term rehabilitation, speech and language, and physical therapy, occupational therapy. So it's a whole variety, a host of, you know, services. That,
We also have skilled nursing care.
Skilled nursing, right.
Term type.
Yep,
Yeah.
skilled nursing care, like folks who are medically frail, they might be bedbound, they may need, you know, or require, you know, one-to-one care, you know, 24-hour supervision. So we really pride ourselves in, you know, working as an interdisciplinary team, you know, between the physicians and the nurse practitioners and the certified nursing assistants and the, you know, down to the orderlies who, you know, take care of the, you know, the facility itself, and keep it running, operating, keep it clean, that kind of thing.
You know, when I say there's a very long list of the things that the programs and services at Parker, typically, like a person wouldn't just call up Parker and say, I'm interested in such and such, or would they? Like, you know, like, is there like a number you call, one number, and it filters you towards what might be the right thing for you?
Yes, that's 1877 Parker 3. 1877 Parker 3, or 718-289-2900.
2100.
2100.
Yeah, 718-289-2100.
They could also visit our website at parkerinstitute.org.
Right.
Mm-hmm.
So typically, if you wanted, you know, someone was interested in any one of Parker's services, they can go onto the website and you could see the whole host of, you know, different, programs and services that we offer. Again, the primary line of business or primary focus is the nursing home, the skilled nursing facility, right? But, if you were interested, if someone was interested in some community services or, caregiver services or support group or something like that, we kind of have, a variety of programs to provide care to individuals in need. But, a lot of times, how do people, get into Parker? Usually if they have, an accident, a fall or a slip, or they have a hospitalization of some sort and they can't necessarily go home, they can't just be discharged straight to the home. They may, need to go to Parker, and they may require some rehabilitation services like physical therapy so that they can, strengthen their, get strengthened so that they can ambulate independently and be able to go back, safely return back to home.
Well, I mentioned before the show that my mother had been involved with Parker probably 25 to 30 years ago, and it was all good experience back then. So we're not selling anything here, but my mother got through Parker quite nicely. So, she went for adult daycare. I think you have a program, or you did then.
We used to have, we used to have a very robust adult day programs, both medical and social models, as well as a very, Alzheimer's and dementia specific, the Granite Center for adult day program. And so it really was very robust. It was really well renowned. And Parker, historically has been a huge institution in terms of inviting the community as a whole to come through and participate in conferences, symposiums, and we've done a lot with keynote speakers, and so we pride ourselves. We have a beautiful auditorium to provide large scale conferences and stuff.
Now, I saw something about home services for medical. In other words, you can have doctors come to your home.
Yeah. So you're talking about our program called Parker at Your Door, or PAYD. And it really is it's a medical house call program, or medical house call practice, where doctors will go into the home to provide on-site medical care in the comfort of one's home. They can do everything from, full-on physical. They can do the lab work. They could do X-rays, EKGs. They can do, blood draws.
Yeah,
they can do all of this in the home. And actually, my mom was a recipient of Parker at Your Door. The nurse practitioner, she came in, provided a full-on physical of my mom, took her lab work, brought out her little scale and was able to weigh her and everything like that. And then later on, we got a technician to come in to provide an EKG in the comfort of her own home. She just laid down in her bed, and she got the electrodes all hooked up to her.
Is Parker at Your Door so is there certain qualifications in order to get Parker to Door? Do we is there a certain age or condition, or is it just anybody's able to kind of?
You have to, the beneficiary has to have Medicare.
Okay.
Medicare coverage.
For Parker at Your Door.
Parker at Your Door,
Right.
Correct. They do accept other insurances, and I can run down a few lists, but it's they accept a few different health insurances, but primarily Medicare. Obviously, it's it's a geriatric program, so if the person is elderly, and it really is for individuals who can't get out to doctor's appointments, right? They can't get out to the offices.
Like get a primary care doctor.
So
part of that.
Parker at Your Door can become the person's primary care provider.
Right.
However, Parker at Your Door also, works in partnership with other medical providers in, if they have a specialist, they will coordinate, the care, kind of, share the medical, history, or, the ongoing medical care that their person may be receiving.
I mean, this could be.
I know every time I see Parker at Your Door, it always blows me away, because I think too, especially, I think we even saw a bigger push to these in-home services, after COVID kind of thing, and I know my own parents, right? It's the convenience of, that and not having to travel is huge.
I have a family friend that has had a wound, so Parker at Your Door went in the other day and assessed the wound, and did plan of care for that.
Yeah.
But they also set up, they triaged it. Instead of going to the hospital, they keep it at home, so they're
Yeah,
working with a home infusion, came in yesterday to do IV antibiotics for a week. And then we're coordinating with the wound care company that's going to go in for weekly wound care. And we're the primary care physician taking care of that homebound.
That's
But we could also
incredible.
take care of folks that are under 65. Technically, we can take care of people 21 and older.
Mhm.
But the majority of people are
Right.
seniors unless they're
Now, is
chronically
there like a long wait list for that? Like, what's like how does that work? Because I know like a lot of these, obviously, it's such a demand thing. Like, I didn't know if it's something you have to wait to.
Well, as long as somebody signs a consent form,
Mhm.
we have their insurances,
Mhm.
things like that, and the family sign the consents. We can, and there's an appointment open,
Mhm.
we can get them in. They do service 7,000 patients in the community.
Wow.
So some aren't, monthly, some
Mhm.
are, every quarter, or
Mhm.
some are, they follow monthly.
Annually.
Annually.
Depending on what.
Yeah, right.
Yeah.
Well, I mean, it's a tremendous service.
Mhm.
I could visualize a lot of situations where maybe the caregiver has a problem themselves. And,
Right,
the
it's
fact that,
difficult, right, for them
yeah,
to get out with,
it's
right.
difficult for them
Mhm.
to maybe get somebody to the doctor.
Takes relief off the family too, because you're in the sandwich generation, taking care of your children
Yeah,
and your
of course.
parents, and you have to take off work to take them to a doctor,
Mm-hmm.
and now they're homebound. It's hard enough to get them out, especially with the snow.
Yeah.
So,
Right.
you can
Or you
coordinate
don't
that.
live near them,
You don't live near them,
or
exactly.
maybe you don't even
Long
have
distance
anybody.
caregivers,
Yeah.
they can monitor the medical care that their loved one is receiving from, through the practice, and knowing that they're being cared for, and, that their
Right.
needs are being met.
We have a family link, and we have remote patient monitoring,
That's what I was
telehealth.
going to ask you,
Yeah,
like,
it's
there's
great.
like my
Telehealth.
chart, there's
Yeah.
something comparable to
We
that?
have the family link, and then we do the they get the text messages. Like,
Mhm.
we continue to evolve with modern
Mhm.
technology.
So the person who is the caregiver, family member, whatever, would also be able to be kept up to date
Yep.
by this family link?
But
Yep.
family link, yeah.
100%. I still get
Mhm.
text messages from mom saying that, she's due for her, flu shot, and she's due for her, pneumonia
Mhm.
vaccine,
Yeah.
that kind of thing. So yeah, we stay in touch. We like to stay, abreast with communication, text messages, phone messages, telephone calls, emails, that kind of thing.
Get your
And
vaccination.
what's the catchment area for that? Like, will you do all of Long Island? Like, how does that
We
work?
do Suffolk, we service from Suffolk to Westchester for that, excluding Staten Island, so all the boroughs in between.
Oh, okay.
Nassau County, Suffolk, Westchester.
And the practice is growing. I mean,
Mhm.
it's, as we are, as healthcare evolves, Parker at Your Door is evolving as well, and, taking on more patients, and, providing, more comprehensive care, to include, and I guess we're going to talk about it a little later, the guide model.
Well, that's what I think,
Yeah.
like, with, this program too, and like, I mean, and how technology is going, right? Like, the idea that you could do so much in the home, I mean, it's just, I even know for myself sometimes, it's like if you're stressed out about, I can imagine what a relief it is, just be like in your home
Yeah.
and having these things done. And I would imagine, working with the population of seniors, so many of our seniors, end up in an emergency room situation because there's nowhere else to go sometimes, or like they haven't been monitored. So I think that having this relationship with a Parker at Your Door has to have, impacted that.
It really is a valuable, service, because again, it takes the stress and burden off of the caregivers to get their person to the appointment. One, schedule the appointment, get them to the appointment. And if they're not having a great day, to get to a 9 a.m. or 10 a.m. appointment,
Yeah.
so many things could go sideways at any given point, between that hour and the appointment time. So this really is, and it's a flexible, service, because, the nurse practitioners and the physicians, they really try to work with the family schedule,
Mhm.
what's convenient, weekends, evenings, during the week. It's not a
Wow.
Monday through
Yeah,
Friday,
that's right.
9 to 5 kind of operation. It's, it's 24/7 access to the care team as needed. If there's an emergency, or there's an emergent situation, but you're not sure if the person should go to the
Mhm.
emergency room or not, they can contact the practice and say, this is what's happening. They may even invoke a telehealth visit and say, okay, let me see what's happening, show me, that kind of thing. And then they can kind of advise the patient or advise the family accordingly.
You have all connected to this. You mentioned the word guide before, which somebody in my family actually got a letter from Medicare saying that they
Everyone's getting those letters.
Yeah, they were eligible under the guide program
Yeah.
for dementia care. whatnot. That kind of ties in a little bit with what you were talking about. How does that, the overview of GUIDE?
Okay, so if you think of GUIDE, it's an acronym, GUIDE,
Right.
Guiding an Improved Dementia Experience, right?
Okay.
And so this is a new Medicare benefit. So it's a Medicare benefit that provides dementia care and support for individuals suffering with Alzheimer's or some other form of dementia. So the criteria is that they have to have a diagnosis of some kind of a dementia, right? They have to be a Medicare beneficiary. And it also helps to support the caregiver. So it's like, it supports the caregivers in caring for their individual with dementia. It came out in 2024 as a new benefit. And Parker at Your Door became a dementia model provider as of July 2025. So we're providing we have about 50 to 60, maybe 70 folks who are enrolled in the GUIDE model. And the GUIDE model itself provides, it's basically a comprehensive wraparound benefit for Medicare beneficiaries. So, and again, person with dementia or Alzheimer's disease who, they need comprehensive care, and the comprehensive care services that we offer. All right, I got 30 seconds.
Okay. Wait,
No.
Otto, hold that thought. I see Otto doesn't like to pay attention to the clock, Dawn, so don't worry.
Okay.
But after the break, we will continue talking with Dawn Hagen, the program director of Willing Hearts and Helpful Hands, and Jeannie Doherty-Benckwit, who is the VP for Community Partnerships. You're listening to Project Independence in You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence in You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Los, and we're jumping right back in with Dawn Hagen, who is the program director of Willing Hearts, Helpful Hands, and Jeannie Doherty-Benckwit. I hope I'm saying that correct, Jeannie. I mean, I know you as Jeannie Doherty. I forgot that they were
I know.
the VP for Community Partnerships. And we're talking all things Parker Jewish Institute. There's so many programs and services. So before the break, we were talking about this dementia guide model. So what does that actually entail? What is that? What does it encompass?
So again, it's a comprehensive Medicare benefit. It's basically a wraparound benefit. And so it's for individuals who have some diagnosis of dementia, as well as, support for their caregivers. So what does a GUIDE model provide?
Mhm.
It's they provide 24/7 access to the care team. They provide education and support to the caregivers about how to care for somebody with dementia, how to respond to some of the dementia related behaviors kind of thing. It's a comprehensive assessment and care plan development, so that they go into the home and they assess not only the patient, the Medicare beneficiary, but they also are taking a look at the caregivers and what the caregivers' needs are, and they're assessing for their levels of stress and burden and burnout, what is their quality of life, and then identifying various strategies for caregiving, making sure that the patient is being cared for, that they have the resources and the tools. So it's a lot of information and referrals, support groups, education, one-on-one counseling sessions with the geriatric social worker, which is tag me. So I am the geriatric social worker for Parker at Your Door. But it's, the physicians go into the home and they not only assess the patient, but also assess the environmental situation as well as, the caregiver needs.
As you march along in life, I don't think there are many people that have not experienced some exposure to some form of dementia by somebody. Now, with the diagnosis, is MCI considered a diagnosis, or?
It depends, because mild cognitive impairment is, it's a precursor to some diagnosis of dementia. As of right now, the guide doesn't, if the person is experiencing with MCI, there may be more a need for more comprehensive evaluation to assess what is causing this MCI. Is it, some kind of a diagnosis like a vascular dementia, or is it, precursor to Alzheimer's, that kind of thing. So having a more comprehensive assessment to determine what the diagnosis could be. Because mild cognitive impairment really is just, it's short-term memory lapses here and there. And it doesn't really affect the person's day-to-day functioning, but it's noticeable to maybe themselves and or their family members or caregivers.
Unfortunately, I know a few people in that arena. Suppose I'm listening to this show and I'm involved with somebody. Who and how can they talk to somebody at Parker who would get more in depth, or how could they get people to come and visit them, frankly?
Right.
How do you go about that? Is that through somebody else, through your doctor, or can I just call up Parker and try to learn?
There's a variety of ways to connect with, any one of Parker's programs and services. There's no just that one way,
Right.
one door, opportunity. So, they can call either Parker at your door. They can call the practice, directly, which is 718-289-2606. They could go on to Parker at your door, or Parker at your door, website, or PAYD, at parkerinstitute.org, which is the email. They can call the main number at Parker Jewish Institute for Healthcare and Rehabilitation, which is the 1-877 Parker 3, or 718-289-2100. And or they can visit Parker's website, parkerinstitute.org, and they can click on, a variety of different programs and services,
Okay.
I mean, I think the 24/7 access, to connect with someone is so incredibly huge part of the program. We've talked a lot about on the show, and as we said, we've all been touched to different degrees, with people doing it. And for the caregiver, I mean, it's just, we said, you're just like thrown into this world, you don't know what
Well,
to
I
do.
had a very good friend. He went into the Sundown experience. And you mentioned something along here in your material about trauma. That was pretty traumatic for his wife.
Yeah.
He ended up threatening the family, and, so you get into a scenario like that. Is Parker a place you might call?
Absolutely. I mean,
Right.
Because, Parker has a variety of community health programs, and the specific one for dementia is the program that I'm the program director for, is Willing Hearts Helpful Hands Caregiver Support Program.
Right.
And this is basically a grant-funded program through the New York State Department of Health. And we provide an array of services to, we provide an array of services to families who are caring for somebody with dementia. So yesterday I got a call from Marie, and she said, I don't know what to do. I need to go to a support group. I need to learn how to take care of my husband, because he started exhibiting with, some symptoms. He became very aggressive and violent, and she, thought he was being abusive. She didn't realize it was he has dementia, or that it is dementia that he was exhibiting with. And so she called the police, and she had she had him arrested. And then it turns out that he was confused. He didn't understand what was happening. And she said, I'm the trigger. I'm the one who sets him off, because he does something that's not right. And then I go to correct him, and then he gets angry with me. And it's so the caregiver support program is really intended to support families who are caring for somebody with dementia, and providing them with resources, education, support services, access to the care team. Again, we go into the home, we do home assessments, we do we assess where the caregiver is in the caregiving process. Are they caring for somebody with early stages, middle stages, late stages? And then what kind of care do they need, or what kind of services do they require? And then we kind of connect them to those resources, whether it's home care, whether it's a volunteer respite, whether it's getting a diagnosis, getting them to the doctor, the physician, to get the proper diagnosis, or even, providing the support, I mean, we run support groups, and we have a support group pretty much for every individual. I run a men's group, and for men who are caring for their wives. We have an adult children's support group for, adult children who have a relative with dementia. And then we just really just try to, provide the level of care and support that the person needs. And if they do require, Parker at Your Door services for the medical house calls, we connect
then
them
you're
with
able to
that.
connect
Yeah.
them, right.
So it's like, we're different departments. If
Yeah,
you think about it,
right.
right? So we have the nursing home, we have the community programs like the Parker at Your Door, the Willing Hearts Helpful Hands program. We even have a transitional care team that, assists with, transition from the nursing home to back into the community and getting the person, easily transition back home so that they have the services that they need. They have the durable medical equipment that they might need, or the supplies that they might need.
I think it all goes into the continuum of care, right? And I
Well,
think you
the
guys have really
dementia
nailed
part of it, to me, is brutal, frankly, and not to be cold about it, but I think it's harder on the people around the person who has the dementia than the person who actually has it.
Yes.
You're absolutely right. And so my motto, and I kind of take it from Teepa Snow, it's like, until there's a cure, there'll be care.
Yeah.
So, right, and making sure that you have the right caregiver, providing the proper level of care that the individual needs.
Which is brutal.
Yeah.
Which is brutal. You're absolutely right. And that's why, I work so closely with the families, with the caregivers, to give them access to call me, find out what's happening, come to me, and we'll make up a plan. We'll come up with a strategy.
Right.
Because a lot of times how these programs came about was families would, march on Washington or march on Albany and say, it's great that you guys want to raise funds for, advocacy and awareness and, to find a cause and a cure and that kind of things. But they, the bottom line is it comes down to, but what right now we don't have a cure, we don't have a cause for it or whatever. But like, what can you do for me right now while I'm in the thick of it, right?
Yeah, like you're in a crisis mode.
Well, the other part of it I read also is that nobody wants this, but you may get to a point where 24/7 intense care is required, and it's, in my judgment, very difficult to keep somebody home for safety's sake for everybody.
Absolutely.
And Parker does get involved in, as far as that goes, like a memory care area.
So yeah, Parker does have a dementia unit where we, folks with dementia, are on a locked unit, and whereas if they are like if they're at risk for wandering or anything like that, then if they, click the elevator door, the elevator won't shut. They can go into the elevator, but the doors won't close, right? Kind of thing. And the dementia care, the dementia care is very specific. It's, working, kind of keeping them socially active, keeping them engaged, providing mental stimulation so that, they're staying connected to, not only to, each other, but also keeping them socially active and engaged.
Well, and I think, we're jumping all over the place because there's so many wonderful programs, but I think
a lot of jumping with.
but to the continuum of care, and speaking of jumping, it's like moving along on things. But we start, obviously you have like the memory care, which is like, more of like an intensive care. And I know you guys also had mentioned briefly about the short-term rehabilitation. So just give us kind of the continuum of care that goes on at Parker. It's available at Parker, I should say.
Right. So someone who may require short-term rehabilitation, say they had, a fall or an accident and they had to go to the hospital, they had to have surgery, but now they're, they can't really go home independently and be able to function. So they may come to Parker for short-term rehabilitation, right? And do the physical therapy, the occupational therapy, where they can, strengthen their, get strength and, so that they're more independent with their mobility and that kind of thing until they can get home safely. The long-term care is really for, medically frail individuals who really they have a chronic medical condition. They require, 24/7 supervision and nursing care, skilled care, whether, physical therapy and occupational therapy could be a part of that, but they might need, respiratory treatment. They might require, IV infusion, or they might require, more cardiac, care. So that would be like more of a long-term situation.
Well, my mother lived with us for 11 years, and we went through all the stages where you finally get to the point where, as much as you don't want to do it, there's a reality that comes into life where you need somebody 24/7, a professional, and you can't have that in a home all the time.
Right.
It just doesn't work. I mean, you can get home health aides maybe, but not the medical type support you need. So probably one of the hardest things people have to make up in their mind, in my judgment, is, okay, it's time to shift gears here, and don't feel bad about it, because it's best for everybody, in my judgment.
No, it's absolutely true. And I think families, have this dialogue back and forth. It's like, I promised my mom I would never place her in a facility or anything like that. And, while the intention is all well and good, to your point, keeping them at home for as long as possible, getting the care in the home through home care and rehab services in the home and that kind of thing. But when it becomes unsafe for them to remain home without the 24/7 supervision, without the 24/7 care, then that's the question. And I think, we try to support the families in that decision, in that, you're not giving up on them by having to place them in a facility. You're not just throwing them away. You're not just, putting them in a facility and walking out the door kind of thing. But it's a very difficult decision for families to come to grips with. And I think a lot of, caregivers experience the guilt of, did I do the right thing? Is this the right thing for them? And that kind of thing.
But I think that's why, the caregiver support piece and what you guys provide is so huge, because I think I could only imagine myself, we touched upon this before, like, it's your first, you don't know how to navigate this world, right? And you're dealing with so many of these feelings. And you hit the nail on the head with just the guilt feelings that people have. Like, I can't tell you how many people I've known that have gone through this, and I think, like, that's what anyone listening, I encourage, to seek out that help, because it's what you guys are there for, to help someone navigate this, and to alleviate some of that guilt and say, like, you're doing the right thing, So it's just so incredibly
important.
There's
any cookie cutter answer.
Yeah, no,
and it's up to.
And that's the thing, right? That's why you need the help, because there unfortunately isn't,
There's a lot of things that go into it, like the physical house that you live in. Is it something that
is it suitable, right?
Suitable for that type of thing.
And and that's become a very big thing now, because successful aging in place, right? So how do you accommodate the home so that it's conducive to aging well at home? And again, but once a time, a person really can no longer be maintained safely, right? And then you have to make the decisions.
And this, we're going to not solve it for anybody. You're right. But I think, in my opinion, and I have talked to my own family, my own children, about my personal situation, which, knock on wood, is okay right now. But I have told them that if I get to the point where I'm not really doing anything, and, you have to come and clean me and do this and that, forget that, it's not fair to the people who are doing that, frankly. And it really is, in hindsight, I think it's kind of not embarrassing, but you really don't want to be in a situation where your children are the ones who clean you and wash you and, do whatever. So I really think it's a very personal thing, but I do believe it's something that should be talked about.
Well, that's
up
I
front.
thought if more people were like you, Otto, I think we'd be
Well,
in
I
an
mean,
easier
it's true of
situation.
all these things. Like, if somebody's diagnosed with MCI, which I'm involved with, you really be fortunate if you can talk to somebody, if you can talk ahead of time about the situation. It would make everybody's life much easier under bad circumstances,
Right. And I think it's very important to have those conversations early on about, what do you want your twilight years to look
Yeah,
like,
right.
or
What are
how
your
do you,
wishes?
how do
Yeah.
you want to have your wishes, right?
Mhm.
You know, advanced directives and, you know, making sure that, you know, everything, you know, your financial portfolio is in place and, you know, the kids know what you want kind of thing,
Yeah.
or what to happen next. And, you know, I think a lot of times, you know, and this comes up a lot in my support groups where, like, you know, the caregivers, like, they've gone through the whole turmoil, you know, from the beginning stages to the middle stages to the end stages, right? And, you know, like, just and learning the how to deal and how to cope and how to, you know, manage their person, you know, their loved one, and then but saying, I have no other choice, I got to do what I have to do, right? And
Yeah. Well, I mean,
Well, Otto, hold that thought, because after the break, we will continue talking with Dawn Hagen and Jeannie Doherty-Benckwit from Parker Jewish Healthcare and Rehabilitation, and all about the wonderful services. I mean, it's endless. You're listening to Project Independence in You on LIU Public Radio.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
Welcome back to Project Independence in You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Los. And we have so much more to talk about with Dawn Hagen, the program director of Willing Hearts, Helpful Hands, and Jeannie Doherty-Benckwit, who is the VP for Community Partnerships over at Parker Jewish Institute for Healthcare and Rehabilitation. It's quite the mouthful, you two. Before the break, though, we were talking all things about, you know, the continuum of care that was going on. And of course, there's some more community programs I'd like to touch on too. But in this world of the continuum of care, you know, within Parker, what I thought was interesting is that there's this Indian cultural unit. So tell us a little bit about that.
so, yeah, this is an Indian cultural unit that is specific to Indian culture. The unit is, you know, decorated in traditional Indian fare, food, and, you know, that their ethnicities are, you know, recognized, and even the staff are very are diverse in the Indian culture. We celebrate, what is it, March?
We're gonna March
18th?
March 16th.
March
gonna be
16th, yeah.
Is it
holy
the
event.
yeah,
the
yeah.
holy,
Mhm.
you know,
Oh,
the
that's
festival
awesome.
of flowers.
Yeah.
Yeah.
Well, I mean, listen, I think what's so wonderful about that is that you know, obviously, you know, we're the town of North Hempstead. I know, and it's the fact that you guys are on the border of Queens, you know, there's such a growing large Indian population. And I think, you know, we talk about this all the time, you know, especially in North Hempstead, there's so many different cultures
Yes.
every day, you know, growing. And I think, you know, I could only imagine, you know, aging, you know, in a space that you might not be, you know, used to, you know, so to have those familiarities and to really embrace it, I think is just such a cool way of, you know, hopefully the future, frankly, with all these different cultures.
You know,
It'd be a
and
good example for the world.
Yeah, no, but I mean, it's just when I saw that, I was like, what a wonderful, you know, thing that you don't see too often, you know, which was
I mean, I live in New Hyde Park, which is very heavily, obviously, Indian, and that's fine. Who cares, you know?
no, it's great because, you know, the residents on the unit, you know, they're living in the traditional cultural, you know, environment, and then the families are, you know, they come and go and they come in, and, you know, it's remarkable to see the you know, the generational, you know, culture. But then in addition to continuum of care, Parker also prides itself in that we have our own renal dialysis unit on site, where folks who require dialysis services can come either outpatient, or even residents who are inpatient can receive dialysis services on site, called the Queens Long Island Renal Institute, Q Leary, we lovingly call it.
Yeah.
And it's right on site, and it's convenient for, you know, not only the community, but also for residents, so they don't have to go out to for dialysis, because you know, folks who do require dialysis, you know, they have to usually get it like every other day. So it's, you know, it's and then we have like 15 stations that they can come and, you know, and schedule their appointments and, receive dialysis on site.
And Parker has physicians on site, their own physicians that they hire. So they're there 7 days a week. Plus on the dialysis side, they have the nephrologist and, we have nursing staff 24/7 throughout the whole building.
It's incredible.
So,
It's just,
really-
it really, it's,
It's
and I
just
think
like-
it's like kind of like this, one-stop shop kind of
It
thing,
is.
we love saying on the show, and I think that those are always the most, successful kind of models really, because it's especially when you're dealing with so many of these things that are such heavy issues, and diagnoses. So I think it's just incredible. And I also saw too that you guys have a palliative care unit in Parker. So
Right. So the palliative care unit really is just, so palliative care in general is really, it's caring for a person who has like a chronic medical illness, right? They're not dying of this illness right now.
Hospice.
right.
Well, that palliative care may
Transition and lead to
transition
hospital.
or lead into hospice care. Whereas palliative care, it's not curative, but it's, they are providing treatment for the person's chronic care. Right. So they're getting medical care, they're getting, supervision, nursing care, medical doctor's care, that kind of thing. And it's really just, it's not, they're not going to be cured of their illness, but, they are going to be treated for their illness, whether it's, to reduce symptoms or pain and that kind of thing. Going into the hospice program or into the hospice care really is when they no longer can benefit from any kind of treatment, but they need more, they need more pain management. They need more comfort care. They need more, maybe chaplaincy or spiritual care, counseling with the families around the person who's, eventually, close to passing away.
And do you provide the hospice care within, Parker itself and in the community, or so it's both?
Yeah, it's both in the community and on site in the nursing home, and it all depends on what the needs of the patient is, and hospice care is it's a beautiful way of a person transitioning to the to the end. It's really just a matter of counseling with the families, providing them with comfort, providing the individual with a safe and loving environment, comfortable environment, neutral. It's not like an institutional
It's
type
good
of
for everybody, frankly.
yeah,
For the people
like
who
music
have to.
therapy, pet therapy, volunteers who come in and, we actually have like a few they're called hospice doulas. Whereas like, they will stay with the person through the end.
Oh my God,
of their
incredible.
passing.
I said there's
Take
some
a
people
really-
that do like real like angel work out there, that is incredible.
Yeah. In Parker, we're very fortunate because we have over 300 active volunteers.
Oh wow.
Not only for
Yeah, right.
not only for the nursing home or for Parker Jewish Institute, but also for the the community programs and the hospice programs.
Wow.
That really are. They volunteer their time too, just like you, Otto.
Yeah.
Volunteer
Now,
your
if
time.
somebody wants to volunteer and they don't really know how they could help,
We have all
how would
various
they go
roles.
about that? Is there any particular number again, or the general number?
The general number, which
Right.
is 1-877 Parker 3 or 718-289-2100, or you can visit parkerinstitute.org. And you just kind of click on the, volunteer opportunities, and it'll bring you to all the various volunteer positions available. So whether it's, working with hospice, with the palliative care, with the Willing Hearts Helpful Hands, being a volunteer in the nursing home. We also work with a lot of universities and colleges to, with student interns.
Mhm.
And so we have a lot of, PA students and nursing students and who come in and like actually get hands-on experience working working with patients in the nursing home setting. So So it's really, it's remarkable to see. And I see the volunteers coming through the building every day, and like they're there for, a variety of reasons. They have their scrubs on because they're nursing students, or they are, they're clerical students, and they come in to help in the administrative offices.
Yeah, and that's such, volunteers are what enhances a program, because unfortunately, there's not enough paid positions, in the world for all these things. And I think too, when so much time is really needed for so many of these things, and people are dealing with, nothing more painful than like a hospice situation, it is just really like the little helping hands of, of Parker. It's just absolutely incredible.
Yeah.
And I also want to make sure we get in. I know you guys have a certified home health care services you provide in addition, in the community. So what is that?
So that is a certified home health agency, which is CHA. We provide home care services to, not only individuals in the nursing home if necessary, but also in the community. And the CHA services really include in-home care. Through a licensed home care agency, we can provide physical therapy, occupational therapy, speech pathology if necessary, wound care, or medication reconciliation, medication management, diabetic care, that kind of thing. So it's when we service the 4 boroughs, barring Staten Island and Westchester, Nassau, and Suffolk County.
And with that, is that, just for our listeners, is there, a time frame that you can, utilize this? How do you pay for it? All those.
So we take a variety of insurances. So we take Medicare, Medicaid, many insurances. So somebody has to have a skilled need. So whether they're coming out of a nursing home and they had a 3-day hospital stay, they could get that if their insurance allows it and gives an auth, or if somebody's home and the doctor feels that they're going to fall, we need a face-to-face order from the physician. The nurse will come in and do the assessment, and whether they need PT or medication reconciliation, wound care. It's intermittent, it's short term. So, when we do discharge, we start, discharge plan on the day of admission. So we want to make sure that, if we assess the home, if they're going to need the long-term care needs, if they need to be set up for Medicaid or their private pay, or they need Willing Hearts Helpful Hands or the dementia guide or other services in our service area, because we use a lot of resources. And
will home health care aid type be somebody who works for Parker or through community partners?
Just like the MLTCs that are out there and all the short term, we contract with many home care agencies to meet the needs, to meet the locations, because the cultural needs, different catchment areas.
Well, the benefit there is that you are dealing with the different agencies as opposed to me trying to call 14 agencies to get somebody.
Yes, they're licensed and bonded, and we have to contract with them. So, yeah.
Now, you mentioned something before, Jeannie, about Parker's own doctors. I read that it seems like an emphasis on the own doctors. Could you?
Yes, because it decreases fragmentation. We have our doctors communicating with the families, the patients, each other, the nurses, and they decide a plan of care that the nurses will carry out. And there's no doctors, doctors can come in if they need, but we still have our own physician. So, it decreases fragmentation. We're on site. If they need to go to the hospital, we try, we can even do blood transfusions. We do IV, we do chemo,
Wow.
So it really helps us stay up to date with the medical care and avoid a crisis. So, yeah.
Okay.
I think too, and that's listening to you guys, for this interview, really what I think is just so impressive is, to just have this connectivity, and that's how you're able to kind of get referred to and put in the right place quicker, So I think, developing this kind of model that Parker has done is so huge, because I know myself, right? Like, that's what we say, where do I go? Who do I call? Now I have to go to this doctor, and now it's like you just become completely flustered, so I think that having this kind of continuity of care is just really just incredible.
I mean, I think Parker, we pride ourselves on, having these, this continuum of care, and also just having all of these community, health programs and services, as well as, being the, a long-term care facility.
Right.
So, I mean, we've kind of, grown and, made a name for ourselves with these community programs, and they continue to grow. I mean, we continue, like, we assess what's, what the needs are, what the times are, dictating, kind of thing. And then and Parker has its own, like, research and grants department where, we apply for various grants, and we do, we have research studies and, clinical trials and that kind of thing. And we really, again, to meet the needs of the community, to meet the needs of the growing population, and what folks need and require.
Now, that's the Nurkin Center.
Nurkin Center for
the substitute.
Oh, she's been dying to say Nurkin Center.
Well, I had never heard about the Nurkin Center. So, that's another piece of the puzzle as far as
it's another division of Parker Jewish Institute is the Nurkin Center for Grants and for Research and Grants.
Right.
So under the Nurkin Center, we're able to provide conduct clinical trials on and at any given point we could have any I can't quote right now. I think we have at least 1 or 2 clinical trials that are in progress, and then also the grants department where we apply for grants for various different programs. So we got a grant for nursing students. We have the Willing Hearts Helpful Hands is a New York State Department of Health grant funded program, as well as what other grants we have for CNAs and nursings, LPNs. And so we really, it's a big department.
Yeah.
And which I'm proud to say, because I'm under the Nurkin Center. Grants.
She's like, that's me.
A question has come from the audience.
Oh. The live studio audience.
As far as dialysis is concerned, relative to the Nurkin Center, is there new methods?
No, I just, you mentioned it earlier, so
right.
I know we touched on it.
So,
well, they do have dialysis. Yeah.
Right. So typically a person who requires dialysis basically is, their kidney failure, and they need to have their blood, recycled and everything like that. So we're able to do that on site, which, because a lot of, dialysis centers off-site or like clinics or medical groups and that kind of thing. So the folks can come, not only from the community, the surrounding community, New Hyde Park area and Flora Park and, whatever, but they also, residents who don't need to schlep out to a dialysis center, they can come to the on-site.
But as far as the Nurkin Center goes, do they have like tests that people can, or trials that people can volunteer for?
Yes.
For various...
Depending on what clinical trial we have going on, there's, obviously there's criteria that one would have to meet. And so if you wanted to find out what clinical trials is the Nurkin Center for Research and Grants is conducting, you can contact the main number, ask for the Nurkin Center, and then you can inquire further about, any clinical trials. And like, sometimes the clinical trials are like agitation and dementia. So somebody who's exhibiting with agitation, but then they have dementia, they may qualify for the clinical trial. And what that involves is, obviously having an assessment, getting an evaluation, and if the person meets the criteria, then participating in the clinical trial, whether it's like, coming in each week and meeting with the doctor to review, if they're getting the medication or if they're getting the placebo, seeing what the change is. So we work with a variety of pharmaceutical, agencies to conduct these clinical trials.
Is there like on a website somewhere, is there a list of clinical trials?
I'll have to get back to you on that one.
Yeah,
Sure
I mean,
it's on the
I think
website.
if you went onto Parker's website,
right,
parkerinstitute.org, you can connect with the Nurkin Center. And
I know, because clinical trials are always, changing and evolving, so it's probably not necessary.
Right. And I think that, there's like a national, clinical trial website that you can go on to.
There's a lot of stuff, and, some of them have bad side effects. I know, they, I don't know the name of it, but the one that works on amyloid plaque with the transfusions.
Right.
And
Well,
trials.
Otto can keep going on. I just want to touch quickly. I also know you have a family call center. So what would that, no, is that the main number?
Yes, no, so I'm not going to give that number. I'm going to let the transition and care team and admissions team
Lead them
give it
into-
to the family.
Okay.
Because it then holds up the line
Gotcha.
for every other
Perfect.
department. But it's great. It helps them, ask the family, the families or the patients, ask the family call center for non-medical issues or
That's
concerns, or they
great.
can escalate the medical issues or concerns. So, and it
Perfect.
ties up, not everybody's coming through.
Yeah, no, absolutely.
Yes, but it's
Well, that is wonderful. But you guys, we are at the end. I want to thank you both, Dawn Hagen, Program Director of Willing Hearts and Helpful Hands, and Jeannie Doherty-Benckwit, who's the VP for Community Partnerships over at Parker Jewish Institute for Healthcare and Rehabilitation. Thank you both so much. I mean, such wonderful. I think we covered all of our bases. I was very impressed. I was doing a lot of checking. I'd like to also thank everyone that was listening. You're listening to Project Independence and You on LIU Public Radio.